conversation here on Lagos Television, and on the program today we intend to bring to you all you need to know about this virus, and of course human metapnuemovirus, otherwise known as HMPV. What exactly is this virus? Are there similarities or differences between this virus and COVID-19? And what are some of the things that we need to know as individuals? What are the precautionary measures that we should take? And although at the moment the NCDC did say Nigeria is not yet at risk, but we do know that when health issues like this do occur, of course, we need to also be on the alert. And so what are some of the things that Nigeria should also be putting in place at the moment, especially at the primary healthcare level? We do have a guest already here in the studio this morning. She's a doctor. She is a public health physician as well as Assistant Director, Lagos State Primary Healthcare Board. Join us this morning as a welcome, Dr. Miriam Oshodi. Thank you for being here on the program today.
Morning.
Right, let's get to it. HMPV. What exactly is this virus? Because again, a lot of fears are already here, and you know, especially when you hear that it's emanated from China, and everybody's asking, why is it always from China? Why is this always? So what exactly is this virus, if you'd like to break it down, you know, to the simplest term that we all can understand?
Okay, so thank you for having me here. Like you said, it is HMPV. That's the human metapneumovirus. So first of all, it's important for us to know that it's not a new virus. It's been in existence for decades. And then also, however, in 2001, it was discovered among, in Netherlands, not China now, among 28 Dutch children. And then it's very similar to viruses that cause respiratory infections. So it's a virus that causes respiratory infections, and then it's been found to be severe in children, older adults, and people that have weakened immune system. Now, HMPV, so for, and that's just the acronym, it's a seasonal infection. It's been found to occur during the colder seasons, and so in other climes between winter going towards spring. And just like COVID, if you remember clearly, COVID came up at about December. Yes, that was around the cold season too. So it's just similar to that. And then the symptoms are similar to COVID and to several other respiratory illnesses. So some symptoms that people can have include cough, fever, runny nose, congested nasal passages, and then they can also have shortness of breath or wheezing. So that's actually what makes it a bit, you know, similar to COVID. However, in severe cases, it could come down with pneumonia, bronchitis, amongst others.
Is that why there's the pneumo? in the name? Because it's nasal.
Yes, it's nasal.
And it's the respiratory system. Right, Jibala?
All right. You rightly said here that, okay, there are similarities between HMPV and COVID-19. So how worried should we be as a country, even though it is not here yet? And what say you to what the DG of NCDC said yesterday, that Nigeria is at moderate risk? Yes.
So as a country, we have done the best. We've started on the right note. The NCDC has done a risk assessment, and risk assessment includes looking at several factors, and we have been identified to have moderate risk. So it only means that, yes, we should be on alert. The World Health Organization has not declared the HMPV as a public health of emergency of international concern, so we don't need to start running. However, all necessary measures need to be put in place. Part of it, very importantly, is at our port of entry, because we know that, yes, Nigeria, it's a tourist destination for several people. Remember, just rounding up the December travels and all. So a lot of people are coming into the country and are also leaving the country. So all the ports of entries, particularly the port health organizations and officials, have been, you know, put on alert. And then several trainings are being carried out to say, oh, when people are coming into the country, we're able to assess them. If we need to quarantine anyone, if we need to isolate anyone, and also necessary questionnaires, information that we need to get from travelers that are coming into the country, particularly not just China. It's not HMPV is not just in China. Okay. It's in Northern Hemisphere. There are other countries, Caribbean, some parts of America that also has.
Yes. Even in the UK at the moment. Right.
Yes. Yes. And you know, it's because at this period there is it's the season. There's increase in number of cases of respiratory illnesses. Okay. So.
Is that because of winter?
Yes, part of winter, yes. Because this organisms, they thrive at those seasons. Yes, yes. So because of the cold season and winter, we have increased number of cases. So China drew out the alert when they noticed that the cases have gone beyond what they would normally have. So that's why there's an outbreak, and there's a tendency for it to become an epidemic and then also pandemic. So that's why other countries are getting alert, and then WHO is also sending out regular guidelines, and as well all countries are taking necessary measures to ensure that, yes, we do not need to start running, but we need to put several things in place to ensure that, should in case it comes to a country, we are ready to get them.
How does it spread? Because, again, sometimes you're not even sure you know what you're coming down with. And so, although you've given us some of the symptoms, and like you've also rightly said, this could also be common with other viruses. Yes. So how does it spread? Is it a contact-to-contact virus, or what exactly is the spread mode?
Okay, so like every other respiratory illness, its transmission is through airborne droplets. So if someone does that has the HMPV virus, coughs or sneeze, if someone has close contact with that person, you can inhale the respiratory droplet. Also, if that person sneezes on a surface and someone else has contact with that surface, so you can pick it up on that surface and then become infected. And because like other respiratory illnesses, it's contagious. Right. So it's important that for anyone that is coughing or has any respiratory illness, we have to ensure that we follow the cough ethics. So you either cough into your bent elbow or you cough into a tissue paper, and you discard as appropriate. And also it's very important that we know that we practice hand hygiene. So this time we need to go back to all the practices, the infection prevention measures that we carried out during COVID. Remember how we're all washing our hands as if, yes, our life depended on it. So it's very important that we start to carry out those activities. So all stakeholders, starting from schools, very important. Remember I said that one of people that are susceptible to are children. Right. So we have to ensure that in schools, these practices are reactivated. All our things, we ensure that they're washing regularly. And then if anyone is sick, it's important that you stay away from public places. If you're having any of the symptoms I've mentioned, it's important that you stay away from public places. You have to call in sick at work. You don't go to crowded areas, because it's very contagious. Right. And you can, yes, and then you can transmit to others.
Is there an incubation period?
Yes, there's an incubation period of about 2 to 7 days on the average, but you know that also depends on individual factors. Some people, for children and people that have weakened immunity, the incubation period can come earlier. Okay. It might be like 2 or 3 days, they are already done with the infection. For however, people that still have some good form of immunity might move further than 7 days on the average span of 1 to 14 days.
Sorry, Jibala, since we're talking about incubation period and immunity, so will the COVID vaccine play a role here for those that got vaccinated at that time?
So COVID vaccine, so for every vaccine that has been produced, vaccines are produced based on this disease entity. Yes. Okay. So it's possible that, yes, you have COVID vaccine for those that took up COVID vaccine, it protected against COVID virus.
So now, it may not protect
it's not likely because they are different. Wow. The COVID-19 is from the coronavirus family. The HMPV is from the Parental. So they are not from the same family. They are not the same family, but however, they all from the respiratory virus family. Wow.
Okay, so how do we strengthen our immune system, even though it is not here yet? You know, Nigerians are a funny set of people. You start hearing all kind of things now. Go and take ginger, go and take ogogoro, and go and do this. How do we strengthen our immune system at this period?
Okay, so it's very important that we take necessary measures. At this period, we know that it's the cold season, and there are several disease entities that are prevalent at this period. So first of all, it's important that we keep warm, cleanliness, and then hand wash. You know, yes, it's Harmattan season for us in our country.
Is it still Harmattan?
But it's supposed to be Harmattan.
It should actually
so let me
be.
keep it like that. It should be Harmattan season for us in our country. So, you know, we have lots of dust and all that. So cleanliness first, starting with your hand hygiene. Very important. The cosmetics that I mentioned, and then lots of fruits and vegetables, yes, to boost our immunity. And if you're down with any illness whatsoever, it's important that you do not self-medicate. You present at the health facility, because you might think that, oh, what I have is just is the regular cough and catarrh, and I know what to use. But it might be a bit more than that, and you will not be able to say what exactly it is until you're able to see a healthcare provider, practitioner that is able to say, no, this looks a bit more than your regular cough and catarrh.
And how about staying dehydrated? Is that also a measure here?
Yes. So, like, you know, part of measures that is important for people that might come up with any form of respiratory illness or at this period of time is to ensure that you take a lot of water, because remember, for us, it's the dry season, so you stay hydrated as much as possible, adequate rest. Very, very important. And then also checking with your healthcare provider if you have other underlying illnesses. Because it's been found that people that have comorbidities, hypertension, diabetics, amongst others, are found to be more predisposed to this disease entity. And it's also very important that we know that the pre-morbid status of an individual, I mean by to say that your state of health before coming down with a disease entity is important. So that's why, like when we're trying to compare this HMPV with COVID-19. Yes, they have some similarities, like they're both respiratory illnesses. Their mode of transmission is the same thing, because it's through respiratory droplets and all that. And then almost the same age group, just as some are more susceptible compared to the others. However, it's also important for us, and severity of these diseases also matter. So your pre-morbid status will determine the outcome of any infection that you have. So if someone has had very good immunity, so to say, and coming down with HMPV, you're likely to overcome it, just like COVID. You understand? But someone that has an underlying illness might do a bit of extra to be able to come out of.
Okay, you and I both know that our borders are quite porous, and they are not well secure. So how worried should we be as a country? And children just resume now, they're just back to school. So what are those things that we need to put in place for these children, even though it is not here yet? But majority of us, we have forgotten about hand washing, sanitizing our hands, and using face masks.
Yes. So it's, first of all, our borders. Let's take it to that. So I said that the NCDC came out with a statement about 2 days ago on the status of the country, and then also the portals authorities have been put in. Unfortunately, we have lots of porous borders. We all know that. And then people just come in legally, illegally, you understand. But however, regardless of that, we still need to put in those measures. So those measures have been put in place, and then particularly, we know that most of people that come in from the Asian country, the northern hemispheres, they come in through most of them, the airports.
The airports.
Yes. So lots of things have been put in place at the airports, and then the portal team, medical team, have already been reactivated to ensure that as people are coming in, these measures are kept. So I think for us as a country, we should not be so worried, because we are putting all necessary measures. Now, for our children that have resumed school, now for any disease at all, preventive measures are very key. It's better for you to prevent than having to come down with that disease. And one of the best ways to prevent, the first way is health education, and that is what we are doing. And we need to sensitize people. We need to increase their awareness that there is a new disease entity that might come to our area. I remember someone telling myself, like, what is this, for goodness sake? As in, what again? We're barely out of COVID and all. So it's important that we need to sensitize people, and also the school providers, they need to know, the school owners, teachers, they need to know, and then also pass this message to the children. And also the parents need to know, because if the children know, they're able to tell the children they learn fast, and they're able to pass the message on to their parents. So it's important that this message gets to them, and they know that we have to ensure that there's a new virus in town. Children are back in school. We know that when they're back in school, then we start having runny nose and all that. But hand washing is very key. And so the school should ensure that children wash their hands as much as possible. And then parents should also know that any child that has any of the symptoms that I mentioned should please stay at home, so that child doesn't come to school and infect other children. And then also, it's not just in school, because the children also leave to school and then go home and then they play with their friends. You can't tell children not to play with their friends. Yes. And then it's important that they pass on that message even when they get home. So it's important that all hands need to be on deck. It's all stakeholders. It's a collaborative thing. It's not just school. The parents are also involved. The health authorities are also involved. So even when you have to, if you are ill, you know that you need to get to the primary healthcare facility as soon as possible. And then also, even the healthcare workers also have to protect themselves.
Right.
Remember, just like during COVID. So yeah. So if you know you're having any of the symptoms, it's important for you to wear a face mask. Wear a face mask. It's not going to hurt. Make sure you wear a face mask to prevent other people from getting the infection from you.
So you did mention when we started this conversation that this virus is not actually new.
Yeah.
It was first noticed in 2001. And this is 2025, though, you know, we started hearing about it again in 2024. And just like COVID, which was novel at that time, would you say that between 2001 and now that, you know, there's an increase in this particular virus, have there been studies? You know, to know more about this particular virus, because just like you said, at the moment there is no vaccine for it.
Yes, there is not.
There's probably also no known cure. You probably have to use other, you know, supportive measures to do this. And while studying for this, I also realized that this is not a virus that antibiotics can actually take care about. So you have to wait it. You have to wait it out.
Yes, it needs to run its course.
It needs to run its course. And so, in the course of study, you know, in the years that this has been going on, is it also the severity of this virus? Is it one that can lead to death?
Okay, so I will pick your point. I won't start from the death because, of course, nobody wants to hear about that.
But it's good to also talk about it.
Yes. So this virus has been for decades. Right. Yes, and then, well, because there's not been increase in the number of people that come up with, like, increase in prevalence of the disease. So yes, studies have been carried out, but not as much as now that, you know, everyone is at alert. Every year in other countries, people have come down with this virus, but most of them have recovered non-significantly, and then it's run its natural course. However, recently China has brought out the data that says that they have more than expected. So that's what we're thinking. Yes, they have an outbreak, and then yes, this we have to be careful before it becomes an epidemic or a pandemic. Yes, so that's on that course. However, the severity of HMPV compared to COVID, studies so far have shown that it's not COVID has more severity compared to than HMPV, and then also it's studies as like you've said, there's no vaccine and there is no treatment yet. So for most of the viral illnesses, it's usually supportive. So that's why you say you have to use fluids depending on the symptoms. So it's going to be treated based on your symptoms. Yeah, so you have to use fluids. Proper hydration, rest. If someone has a fever, you give antipyretic, as the case may be. So it's not an antibiotics thing that we...
Yeah, so that again comes back to what you said, self-medication.
Yes.
Because a lot of Nigerians also can do that. Yes. I'm sneezing, let me get antibiotic.
Yes.
I have a cough, let me get antibiotic. So it's clear here that HMPV is not one that antibiotic can be used to support.
No. It's only if the person has a superimposed bacterial infection while having that HMPV that might require antibiotics. But that's not treating the HMPV, it's treating the superimposed bacterial infection. Yes.
I'm more concerned about grassroots and the state of our primary healthcare centers, not in Lagos here, but in other parts of the country. You get some part of the country and they barely have one or two primary healthcare centers. So how do you think we should drive these this particular matter in tackling HMPV, just in case, because you can never say never?
Okay, yeah, very right. So, well, you said not in Lagos, because we know that in Lagos, yes, we have quite a good number of our primary health care facilities that are up and about, and then we also have our comprehensive facilities that have the doctors there. So, in Lagos, what we're doing now is just sensitizing our healthcare workers to know this is what is on ground. And
even at the grassroots?
Yes, because the grassroots come to the primary healthcare center. Primary healthcare center is the first point of call for anyone that is, before they go to the secondary facility, that's the general hospital, or then the tertiary, as the case may be, if necessary. So the first point of call for the grassroots is the primary healthcare facility. So it's important that the primary healthcare facility personnel are also alert and they are aware that, yes, this is what is on ground. And then, so when you have cases like this, you tell them what necessary to do. And if it becomes complicated, it's something you can treat or you can manage, refer appropriately to the secondary facility. Now, for other states, it's important that we need to revitalize our primary health care facility, just like the MPHCDA has been doing that for a while, revitalizing primary health care facilities. So it's important for the states to also learn from Lagos, you know. I know a lot of states are doing beautifully well, for them to also re-equip their primary health care facilities, train the healthcare workers, and provide the basic. Every primary health care facility has the basic drugs, basic things that primary health care facility must be able to provide. So if someone coming out with any of the symptoms can get to primary health care facility and get the basic things before being referred to the secondary if necessary.
All right, Joy has a question. Joy, your question?
Doctor, I want to know, what can parents do to help boost the immune system of their children?
Okay, so it's important that as parents, we need to start with the even meals of our children. Several parents send their children to school without meals. Yes, we know that the country is a bit hard, you know, but even imagine a parent that will not give a meal to a child, but will give all this
the snacks,
snacks, the drinks, you understand? The fizzy drinks. So if you can afford to buy that, you should be able to afford to, even if it's little rice and boiled egg, you know, yes, we know everything is pretty expensive now. So parents need to help with the immunity of their children. It's very important. We need to give them meals as much as possible, fruits and vegetables as case may be as affordable, and then even cleanliness in the house, you know. The children don't have power to help them might not be able to clean the house, you know, depending on the age group. So but the parents have a role to ensure that the children thrive in a very clean environment and also imbibe culture such as hand washing, coffee, you know, clean the surfaces. This is time to do that extra deep cleaning for the houses, clean the surfaces as much as possible, because, you know, children will always they'll see things on the floor, pick and put in their mouth, yes. Even collect things from their friends and put in their mouth. You almost don't have control over some of those things.
Right.
But as parents, it's important that we also tell these children, oh, there's something else that's up. Just like when COVID came, everybody was alert. The children knew about COVID, even more than several parents. And they were going home to teach their parents that, oh no, they've taught us this in school, this is the thing. So it's important that the parents also enlighten their children and then tell the children the necessary measures, so that if a child can come to school and say, oh, mommy, my friend has cough, my friend was coughing. So the mother or the caregiver can take that extra caution and inform the teacher that, oh, my daughter said someone is coughing in class. So we need to inform that parents to ensure that that child doesn't come to school until the child is being treated.
Right. Though a lot of people might think that we're actually out of COVID, but I think that is also erroneous. COVID can still come, anybody can still come down with COVID at any particular point in time. But can COVID and HMPV coexist in an individual?
Okay, so yes, it's possible that someone can have several viral infections at about the same time.
Okay.
Yes, and also because they have very close similarity. They are both viruses. The mode of transmission is the same. It affects almost the same age groups. Seasonality is the same. Even the viral load is almost the same. So it's very possible that someone can have the HMPV, sorry, and then can have COVID, can have the respiratory syncytial virus, can just have big amounts of virus.
And they all present the same way. In one body. No,
no, but you know that people can have several bacterial infections. Just the same way when we tell people to, okay, you might have a bacterial infection, and say you might need to do a blood culture or something, and you see several organisms in one person.
Wow.
So it's very possible.
So this is why it's also important to, from time to time, check with the healthcare providers, so that you can run certain tests.
Yes.
Because some of these bacteria also, we come in contact with them through food, through water, and so some of the times we also need to check our status.
Yes.
And so again, this brings me to, I know that during COVID, the World Health Organization was very particular about the strengthening of PHCs, because they are the closest to the people. And so is there, will the HMPV also be another eye-opener to the need for state governments generally to, as a matter of priority, continue to fund the PHCs and also perhaps create more?
Okay, yes, you're very right. It needs to be, they need to see the PAT as priority. Sometimes towards the end of last year, we had the monkeypox clade 1B scare that was in parts of Africa. And then, yes, we had to activate our emergency operations system centers, particularly in Lagos and some other states in the country. And then just at alert, luckily, we didn't have that come to our country. But we're on standby should in case it comes, because like you rightly said, it starts at the grassroots. Most of them go to primary health care center first before they even get to other facilities. And so it's very important that the primary health care centers are up and about. It's not, I don't think it's about creating more primary health care centers.
It's about funding the ones that are
and
available.
making the functionality of the ones that are existing.
Okay.
Because remember that we are still battling with brain drain. Some of the health care centers don't have enough
personnel
to run them. Some of them are particularly turned to the health post. You might get them, I just see a community health extension worker, or maybe only one nurse, you know, to cover for a large catchment area. So I don't think it's about all creating more primary health care centers. It's about all revitalizing the ones that are in existence and making them functional. So if you have a primary health care center that can serve at least over 5 kilometers of people competently, it will go a long way. So I think not just Lagos, state governments in general need to look into that, because there are so many moribund primary health care facilities in several states in the country.
Right.
I won't say Lagos, because Lagos is doing a lot of work. A lot of work. Lagos has comprehensive primary health care facilities that have almost full strength of healthcare providers. Of course, yes, it might not be enough. Yes, but you can, for every local government in Lagos, you have a comprehensive primary healthcare facility that has a doctor, minimum of 3 doctors, has nurses, has has a full-fledged medical personnel that can take care of it. And then they also have other primary healthcare centers in the local government that those serve as start point that can refer to their comprehensive facility, and then the comprehensive facility goes on to refer to the secondary facility as case may be. Just it's important for us to ensure that we put our referral system in all the And so the other state governments can also learn from this to revitalize those existing primary health care centers, and not just continue to build and launch and all that.
I'm still going to take you back to how we can strengthen our immune system. You rightly suggested the other time that we should take more fruits.
Yeah, fruits.
And Harmattan is on and off. There will be a lot of dust, and there will be a lot of body contact on this fruit. So how careful should we be when buying fruits as well?
So, yes, very good question. Remember that I'm sure there was one time we saw there was this viral video that went around about somebody washing fruits in the gutter or something. Right. Yeah, so it's very important that even when we're buying our fruits or vegetables, let's avoid buying the open fruits. Right. So the cut fruits, let me put it that way. You understand? Because you don't know the utensils that have been used, whether it's been properly washed. So even if what you can afford is closed fruit, buy and wash properly. You can't just pick an apple and put it in your mouth. There's Harmattan. You might think they sprinkled it with water or something. It might not be properly washed. So it's important that even the fruits and vegetables, we wash them properly before we consume them. And then also, very importantly, buy from reliable vendors. Not the ones, because you don't know whether this person has washed it in this kind of water and all that. Yes. So it's important that that takes me back to first night. It's a cleanliness. Hygiene, we need to be top notch with it, because we need to wash, even not just our fruit. Remember, I said part of the ways that this can be transmitter is on contaminated surface. So I've been speaking for a while, and I'll have respiratory droplets. It's about touch this surface here, and it's important that even after the session, this surface needs to be clean. You understand? So even just the same way, we need to pass that message on. So even with our fruits and vegetables, we need to wash appropriately, and then even there are some people that don't like take water. Take lots of water. It's important. Take lots of water. Exercise, respiratory exercises. Even when we're blowing balloons, it's a form of respiratory exercise. Yes. So respiratory exercise, go for walks. You don't have to, even if you don't have a treadmill at home or something, you can go for walks and time yourself, It helps to boost your immunity, prepares you.
But when you walk, you sweat.
Yes, you sweat. You have to burn it out.
And when you get home.
And then when you sweat, you drink water.
Okay, and when you get home?
You're going to bed, and you go take a shower when you get home.
Immediately?
Almost immediately. because you're burning it out. You need to replace that fluid, yeah, because you're sweating. Yeah, so you need to replace that fluid to stay well hydrated.
I'm just particular about the contact.
Yes.
Like you rightly said when explaining the other time.
Yes, and because remember that when you're sweating, lots of things, it will be very easy for things to
settle on your body.
Face, on your body, yes. So it's important that you get home, you take a shower, you take a bath, so that even if you might have the virus, you're not even transmitting to other people. Yeah, to someone else.
All right, but before we allow you go, we'd like for you to again, please tell our viewers some of these symptoms and why it is important to present early to a medical facility immediately you notice some of these symptoms, and also help us clear the air about the confusion in diagnostics when it comes to things like this.
Okay, so symptoms again could have runny nose, congested nasal passages, cough, fever, shortness of breath, and wheezing, amongst others. And then that's on the symptoms, and it's important that you know that if you have any medical illness at all, any illness, it's important to present at the primary health care center or the facility as soon as possible. Okay. Because the earlier you present, it could also, if you present early, rather, it could also reduce the severity of that illness. Okay. So imagine someone that has HMPV that we were talking about, just to say, and then person has not been self-medication and using all whatnots. And then that person develops complications and present at the healthcare facility, compared to someone that just has the first symptom and is already running to the healthcare facility. So the outcome of the person that had the early presentation is likely to be better compared to someone that's had complications, and then you might need to have to refer to other facilities as the case may be. So it's important that we present at primary health facility. It's important that we improve our health-seeking behavior. We should not just think that, my neighbor has had this illness and then she used ginger, and you're saying ginger and let's say garlic or something.
Or salt water.
We're not saying, salt water. We're not saying we should not use anything.
Bad.
But please, it's important to present at the healthcare facility as soon as possible. And then on diagnostic, yes, for all viral illnesses, the mainstay, the gold standard is the PCR. That's the polymerase chain reaction test. Yes, test. And then, yes, we have that facility in several places in the country. However, most of it is tailored to that particular illness. So, like, remember when COVID came, we had to, getting a positive COVID sample to run our test to say, yes, our system can check for this. So the same way with HMPV. But for now, since it's not a PAEIC, that's Public Health Emergency of International Concern, might not yet be running it, but of course, there are facility structures put in place that should, in case we need to start testing people, yes, we should. We have the capacity to get that done.
Well, I'm sure that you've learned a lot about this virus this morning, and the need for us all, if you do come down with any of the symptoms mentioned by Dr. Oshodi, please don't self-medicate. Present yourself at a health facility as soon as possible. At least if you don't want to protect yourself, protect the life of other people around you. Thank you so much, Dr. Miriam Oshodi, Public Health Physician and Assistant Director, Lagos State Primary Healthcare Board, for finding time to educate our viewers this morning.
Thank you.
Thank you so much. We'll take a quick break. When the conversation returns, another conversation this morning still around the environment. Remember, at some point in time, the Lagos State government had said there will be a ban on single-use plastics. This morning, again, Joy will be taking a look at some of the dangers inherent in the continued usage of single-use plastics.